If you haven't gotten a chance to it, we can come back to it at the end. Um, Today we have two medical students from Campbell and from East Tennessee State University. And yeah, let's get started.
So we wanted to thank y'all for picking up the t-shirts. If you ordered one last year, we did email you about those because we just recently got them back in our possession from COVID. So we emailed you and a lot of people came and picked theirs up. We do still have about 7 of those, I think. So we'll be sending out another email to those 7 people who haven't gotten theirs. But thank you for coming and picking yours up if you did already.
Somya, I think you're muted.
Sorry, guys. So we're just going to go over some online service opportunities again. You guys can feel free to like screenshot this or take a picture. So one of them is Project Sunshine. So you mail in masks for pediatrics patients. Another is Translators Without Borders. So you can scribe some medical documents. There's Chemo Angels. So you send cards to chemo patients. Do Something, you work with senior citizens. 7 Cups has training involved. I think it's 30 minutes to an hour. So then you are trained to help and consult people with mental issues or that are going through a tough time. Be My Eyes is an app that helps with the visual impaired, so you volunteer to help them throughout their day. Learn to Be, you volunteer with K through 12 students. And Help at Your Door is a lot of different ones, like you can deliver groceries and go shopping for people.
Okay, hi everyone. So I just wanted to mention to everyone that a clinical experience chance. So I work as a HAB tech through Maxim Healthcare Services, and I work with individuals with intellectual disabilities. So I help provide one-on-one services and help those individuals through their treatment plans and goals. And you can do other tasks as driving them around or bathing them. So the ultimate goal for them is to develop life skills independently. In other words, it's essentially a caregiver. So if you're interested, they are hiring. I'll probably put another slide within this PowerPoint before it gets sent out. So I'll probably drop down my email in the chat box, and you can email me and I can give you the contact information so you can reach out. Yep. Also leading up to our social media. So we really wanted a way to for everyone to start networking and connecting with other pre-med students like yourselves. So follow our Instagram at NC State Pre-Med, and towards the end of the meeting, we'll have an Instagram post where you can drop comments and introduce yourself. You can include interests, involvements, and also we will have a Google form that you can fill out to be part of the Pre-Med GroupMe if you're interested.
All right, y'all. So just leading into our guest speakers, I wanted to mention these results from the poll that we sent out a couple days ago. So for the question, have you considered choosing the DO path before? We had almost half say, it was almost 50-50. We had 35 yeses and 42 nos. And then for what path or paths are you currently on? We had 47 say they're currently targeting MD, 1 say they're targeting DO, 19 say both, and 10 say they're unsure. Thank you for responding to our poll. We appreciate all 77 of you that filled this out. And we are looking through your feedback for the other questions for the rest of the semester. All right, so on to our guest speakers. We have 2 medical students today, as Mohammed said. Our first is Abby. She's a MD student at Quillen College of Medicine at East Tennessee State University. She is a 3rd-year student, and I'll have her go ahead and introduce herself.
Hi guys. My name's Abby Lazax. Like Ryan said, I go to Quillen College of Medicine, which is a MD school in East Tennessee. I am an M3, so I'm currently in clinic right now. I'm on my family medicine rotation right now. So it's my last day of family med, so it's awesome. But yeah, we'll get into more questions later.
All right, we're glad to have you here with us. All right, and then we have Jan. He is a DO student from Campbell University's Jerry M. Wallace School of Osteopathic Medicine, and he is a second-year medical student. So go ahead and introduce yourself.
Thanks, Ryan. Hi, guys. My name is Jan. Originally from New York. I came down here for a master's and then subsequently medical school. Like in my bio, my parents relocated to Charlotte. So one of my biggest reasons for picking Campbell was being close to home. So I'm excited. I saw there's only one person interested in DO, which is fine. We can, I'm just going to be as very transparent as possible, and we'll give you guys all the facts and all that to help you with your decision moving on.
All right, thank you very much. All right, so let's get into our first questions of the day. So can you explain the difference between an MD and a DO? Do MDs and DOs have differing perspectives of medicine and the human body? And if so, what are they? And what we'll do is I'll have Abby lead us off on this one, and then we'll kind of flip-flop as we go through the different questions.
Okay, can you guys hear me? I just saw the chat that people might not be able to hear me. Okay, I can talk louder. I'm just like trying to not be too loud since I'm in the clinic. I'm literally in a patient room right now. There's not a patient in here though, just to clarify. So difference between MD and DO. Actually with our program, it's pretty interesting because I just spent a week in a different clinic it's a family medicine clinic that has both MDs and DOs. So I got to see a little bit more of the DO training in action. So the main thing is like you're both doctors at the end of the day. I know that it's the day old whatever pre-med debate of is MD better, is DO better? And I'm going to be really honest and tell you nobody really cares. I mean, if you're wanting to be a cardiothoracic surgeon or a orthopedic surgeon, would it behoove you to be an MD? Yes, that's just a fact. However, as far as MDs and DOs, like I really do. I know people that chose to go to a DO school over an MD school, and part of that is because of the different perspectives of medicine. And honestly, my interest, I realized when working with residents that are DOs, do kind of lie along more of the DO route. I kind of wish I had learned a little bit more DO stuff because the way in which I'm sure Jan can add more, but the way at least my perception is that with MD, you'll have a patient come in and you're talking to them, chatting with them, trying to figure out what the differential is, what the issues are, and the main two routes that we go are like diagnostic lab testing and doing medications, maybe assigning physical therapy, maybe doing if they're having like behavioral or mood issues, maybe doing something with that as far as sending them to counseling. Whereas alternative medicine techniques, I feel like are a little bit more used in DO. And please don't have the misconception that alternative medicine or whatever is like a bad thing or not a legit thing, because it definitely is. Because I've seen a lot of patients like in the past week that went to DO doctors in the clinic and no medication could touch their neck pain, their back pain, their awful debilitating migraines, but then they did acupuncture. That's something that specific clinic that some of the DOs do or had training in, or they do OMT. And so they have an OMT clinic, which I am really going to defer to Jan on that one because I don't know a ton about it, but it's essentially like a different way of helping your patient, I guess more like a hands-on physical therapy. Jan, you want to jump in here?
Yeah, I can take over from here.
Perfect.
I agree with everything that Abby said. Like really, like no one cares what the two letters after your name is. It's really like you getting into medical school. The big difference, kind of what like Abby was alluding to, is that we believe in like a holistic approach. And
yes.
what I mean by that is like, I'll give you an example. You have a patient that comes in with muscle pain, right? You can do some lab work, but most obviously the route you're going to treat medically, like with medication, ibuprofen, NSAID, whatever the case may be. But all you're really doing is masking that you're treating symptomatically, right? You're not finding a cure, if you want to say, you're just treating a symptom. But if you're not completely taking away the cause of the symptom. All you're really doing is masking it. So upon like further inspection, you can say like, okay, well, their shoulder pain really is that their rib is misaligned. And one of the techniques we learned in OMT is like rib alignment and all that stuff. So you finding the true cause of their pain, fixing that will alleviate it more than just masking it with an NSAID, for example. So that's really the only difference. We only take one extra class and MDs do, which is OMT. Acupuncture, I've never heard of like a DO person doing it, but that's cool, I guess. But for OMT, really it stands for osteopathic molecular medicine. That rib example was a common go-to I go to, but it's kind of like a more hands-on approach. You're learning a little bit of what PT does and what chiros do. Like we learned HVLA, which for people who go to chiros is like that popping sound you hear when people pop each other's necks and back. That's something that I like to do, like especially for my family members. I have a lot of people with chronic ailments like neck and back pain, and learning that and going home and treating them and seeing the difference I'm making as only a second year. It's pretty cool for myself. So that's really the only really big difference between MD and DO, is that we do have an extra class, what is OMT, so osteopathic manipulative treatment, or OMM, manipulative medicine. OMT is synonymous. You can use them interchangeably. That's really the big difference. It's just really like a patient approach, right? We're still treating patients, with imaging and your classic Western medicine approach plus an extra like tool that we can use is really the big difference. So that's just prospectively speaking between the two of them.
All right, thank you. So our next question is, why did you choose one program over the other? Did you apply to both MD and DO schools? And what would you recommend a student consider when trying to decide between MD and DO?
Ron, you want me to go first? I say we're trading back and forth.
Yeah. Mm-hmm.
Okay. So biggest advice I can honestly give, choose a place that fits what you're looking for, whether it's MD or DO. Abby alluded to it. I'm really glad she did. I have a lot of people in my class who got into both and picked Campbell over other MD schools. To me, that's just their preference of like the perspective and also like what Campbell offers. My story is a little different. I did a master's program right after undergrad to try to improve my my prereqs for school, and Campbell had a program. Luckily, I was able to do well enough where they let me submit a late application to the cycle, and I started medical school a year earlier than I was supposed to because it was a 2-year program. So it was the only school I applied to, and it was, so hence I didn't apply the MD route. I would have, if I did wait to the summer like traditional students to apply, I would apply more broadly. But for me, like I really didn't care about whether MD or DO. Me personally, I want to go into emergency medicine or internal medicine. Both are very achievable as an MD or DO. If you're trying to be a neurosurgeon or cardiac surgeon, it's not unheard of or impossible to do as a DO. We had one person last year match neurosurgery at Baylor University. But are your chances better as an MD? I would lie to you if I say that they aren't, But again, it all depends on how you do with boards and all that stuff, which Abby could definitely allude to better because she's already gone through boards and I just started. So the reason I picked Campbell for really was what your values and what you're looking for, make sure it aligns with the school. So for me, I was very involved with, it's funny, it's all Project Sunshine. I was very involved with Project Sunshine. I was involved with a club called MedLife. So I went, mission trip and like rural medicine was something that was very important to me. I went on a couple mission trips before medical school with Campbell. So them offering medical mission trips was a really big plus. We're one of I want to say a handful of schools that has their own student-run clinic for patients who don't have health insurance. So you'll be seen by a first-year, second-year medical student, a PA student, and a pharmacy student, and you're running the show. And then, of course, there's an attending, and you go back and you ask them, like, okay, I think this is going on, and you'll see the patient with the clinician. So I thought that was really cool. I was able from year one to see a real patient in a controlled environment. And also the sim lab, our school is only about 7 or 8 years old, so we have like pretty state of the art sim lab, which was really cool for me, especially going into EM. So that's my spiel. I'll turn over to Abby now.
Okay, so as far as applications, I am a little bit different from Jan in that I graduated in 2018, and I applied, I guess I was a junior. Yeah, that's when you apply and you interview during senior year. Honestly, it feels like forever ago because I feel like medical school ages you like 50 years each year. But yeah, so I only applied MD my first year applying. I mean, I think people pretty much know that applying in-state to public schools, you're more likely, like the percentages are typically higher of like where you're going to go. I did apply to a few places outside of the state, but pretty much knew like in-state is probably where I'm going to end up going. I did not apply DO my first year. And honestly, like in retrospect, I feel like it was just because like full transparency, like I got some type of grant or something. I can't even remember what it's called right now with AMCAS or whatever it was that I applied with. So I had like free applications to MD schools, and I probably could have done that. One second on that question. Sorry, a little ADD. I probably could have done that, but I just decided to go the MD route. And if I had to reapply again, I would probably do MD and DO. And I do think, I'm going to be honest, when I was in your shoes, I kind of thought, oh, well, you know, I don't know, maybe MD is better than DO, so I'll try just MD first. Retrospect again, I really don't think it would have made a difference. And as I've been in the clinical world, I honestly sometimes think DOs can sometimes be nicer than MD doctors, and patients like them better, honestly. And that's not to say that's always the case, but it's true. Like there's no founding for having this thing against DO doctors, in my opinion. As far as if you're trying to decide what you want to do, totally agree that Jan hit the nail on the head is you need to go wherever you think is best for you. That's how I picked where I'm at med school. You're going to spend the next 4 years there. If you don't feel like people care about you as a student, and that's one thing I am going to harp on. I do know that there are some DO schools, especially more local, that I won't, name names or anything, but just make sure that the school is like a good DO school or MD school, and they're not just trying to look at you as a number or for your money, because you should look at retention rates. These are things that no one ever told me that now that I'm a student, I wish I knew, because there are some scammy-ish DO programs or MD programs where they don't really care if you graduate. They just are ready to get that first semester of money. And I'm going to be real with y'all about that. So just make sure you keep on the lookout for things like that, because unfortunately that's the world we live in, and it is scammy and it is skeevy, but that's what people do. So yeah, definitely if I had gone back and done it over again and had applied MD and DO, honestly, I don't think I really would have thought about the difference between the two that much. I wouldn't have thought about them in two different categories, except for the fact of like that they have that OMM or OMT class. If that's really important to you and something that's a priority for you, then yeah, look at it that way. But other than that, choose whatever place you're willing to spend the next 4 years of your life, because med school is miserable, honestly, and you just want to be somewhere where you're happy. And then yeah, someone did answer the question about MCAT. People sometimes take at the end of sophomore year, junior year. That's the traditional way. You don't have to do it that way. I took it even as late as September of my junior year, which was late. That means I submitted my application without an MCAT score. And then whenever the med schools got it, whatever the score was is what they got. And I don't think that necessarily hurt me. But we can get more into the application process later. But yeah, I think either way, keep your mind open and make sure you go to the school that you feel most comfortable at.
Before we move on, I just want to add, because Abby, again, I love the response. Another reason I picked Campbell, and a lot of people that chose Campbell over MD school was we've had 100% residency match for the past 4 years. I think we're on year 4 and 5 now. First time step pass rate is like 96, 97 percentile, with our average board score being much higher. Our average board score is higher than the national average. So even for a school that's only about 7 years in, and we're already a top 5 DO school in terms of boards, and higher than the national average for boards, I mean, they're doing something correct. And you're sending 100% of your kids to a residency, which is the whole point. Like, we have to work to pay back our loans. I mean, that's something that's very important to, should be important to everybody, but was very important for me too. And then for MCAT, I mean, it's different. I took 2 years. I just turned 26. Abby's younger than me and is a third year. So everyone's gonna finish their race differently. I graduated in 2017 from undergrad. I took a year off to study for the MCAT. I took it twice actually, and I think we're gonna touch up on it. But run your own race, guys. It's not like everyone's gonna, if the goal is to not take any gap years, if that's what's important to you. I loved my gap year. I would not trade it for the world because this is hectic. Like if it's finals weeks on steroids. So I enjoyed the fact that I took 2 years off between medical school and undergrad to just, do whatever it is you want to do before, because like life will get a lot harder once you're in med school compared to undergrad. And that's just the truth. So it's your own race. If you can take the MCAT as early as possible and you want to just go straight ahead, Godspeed, all to you. If you feel like you might need a little extra time to study for the MCAT like I did, there's no shame in that. You're still going to all be doctors at the end of the day.
All right, thank you, Will. So our next question is, have you ever thought that the program you chose might not be the right path for you, and why did you decide to stick to it?
I think this is me up. So I've never thought that MD, like necessarily MD versus DO wasn't the right path. I think it's cool that I got exposure to DO techniques. And the cool thing is like last week when I was in that office, they were like, oh yeah, let me just teach you. And yeah, would it have been great to have a course on it? Yes, but I don't think that it hurt me to, learn it from a resident. I think it was a great learning opportunity. As far as medicine in general, I think it's really important for you all to know that this is 100% what you want to do. And I think I don't know a single medical school person or student that has not thought, what in the world did I get myself into when they got accepted? Because inevitably you'll think that. It's a hard path, it's a really long path. And I think that's when you're really grinding down, especially during board season. I just took the USMLE step 1. You have got to have more meaning into why you want to be a physician, because if not, you're not going to want to do it. It's just not worth it. So really think long and hard about this being the path, because for me, there are days, honestly, they're probably like 3 times a week that I'm like, what in the heck have I done? I'm in so much debt now. And now I'm like, do I marry someone in the NFL to pay off my debt? Or like, how does that, is quit med school now? But no, honestly, I think the thing is that at the end of the day, I know that I wouldn't be happy doing anything else. And so I think that is what helps you push through. And if you don't have that, then you'll have a really hard time, I think, pressing forward in medical school.
Yeah, I totally agree. I mean, I don't regret choosing Campbell. I love Campbell. I love that it's a very non-threatening, non-competitive environment where everyone helps everyone. I mean, it's really, as corny as it may sound, it really feels like a family. Like, especially from pre-med, as you guys are all experiencing, can be very cutthroat, very competitive, right? You're all competing with each other to try to get the very best grades. And I had enough of that. So to find like a program where it's like, we're all here to help each other out. Like routinely people will do like pages of pathology or pharmacology and send it to our group Facebook, be like, hey, if anyone can benefit from this, like I did, and that person took hours, if not days, to complete, and she shared it like it was nothing. Like, oh, I hope you all benefit and all do well. So that's really important for me. Regret going to program? No. Do I think every day like what the fill in the blank that I do here? Like, have I thought about, like, of course, like it's just a defense mechanism. You're like, oh, do I just quit now? It's like, but you just have to remember your why you're here, why you're doing it, and it'll push you through.
All right. So, so for our next question, we'd like for you to tell us about the medical school that you're at, so we can learn a little bit about them. And I know we touched on earlier, like how to, like some of the deciding factors, but if you could touch on like what really made that decision for you.
So I touched up on it, but the student-run free healthcare clinic was number one. Mission trips, again, that non-competitive, like family knit community was I was really looking forward to. The sim lab, if you guys are only like an hour away from our campus, so we usually have like Shadow DO Day or I think there might even be a video about it, but check out our sim lab and our OSCE suites where you have your standardized patient is like really state of the art. That was like that reason a lot of people chose like Campbell over any other DO school or some MD schools. And again, the fact that 100% residency placement and above average national board scores, that was like the deciding factor.
For me, I'm a Tennessee resident, and we have a med school in Memphis. We have 2 med schools in Nashville, Meharry, and Vanderbilt, and then we have this med school that I go to in East Tennessee called Quillen. So again, I did apply to, I think I probably applied to like 15 or 20 schools, but again, it's because I think it's called Fee Assistance Program, which honestly, I just recommend all of you just apply unless you super know that you're not going to get it, because why not? I mean, you get, I don't know, 12, 15 free applications up to schools. It is a lot of money to apply to schools. So the more that you can get, the better. And so I probably applied 10, 15 schools. As far as deciding what school is best for you, I interviewed at a few schools. And I think that you, again, have to have your own priorities. And once you make it to a school's interview, I don't think it's really about your grades or your GPA at that point. Once you're at the interview, it's whether or not you're a good fit for the school. And I think for me in particular, my school is Quillen. It's super small. I only have 72 people in my class each year. I know every single person in my class. I know all of my deans. My dean has taken me to a birthday dinner because we were on a conference trip once. So I think that smaller environment is what I wanted. I went to UT Knoxville for undergrad, which is obviously a very large college. So I think I knew that for me to thrive as a medical student, I needed a smaller medical school. And so that's ultimately why I ended up choosing Quillen, because I do think the one-on-one assistance, the fact that I email my professors, the fact that they email us and we go on hikes with them all the time just outside of school. Again, I felt similar to Jan in that I feel like it is a family, and that's very cheesy. I also feel similar to him in that I'm not a person who wants to do a cutthroat kind of school. If I went to a school like that, I would not be doing as well as I am in med school, truly, because I think like if you're that kind of person who can deal with that, that's great. I think, that's just a different personality type than mine. Whereas my school, we have a whole big class Google Drive, just like Jan is talking about. Someone will do a whole Anki deck and set it up for the entire class so that everyone can go through those flashcards. Or we're all just very supportive of each other. No one really cares about class rank. No one even talks about it. So I think that those are qualities you have to assess your own personality. My personality, this is the school that worked for me for being smaller. They have a rural track program, which is what I'm in. So actually right now I'm in Rogersville, Tennessee, even further east, because I want to work with rural and underserved populations. And so that's something that attracted me. Again, that small size, a small town community feel, that's what I want, because that's what fits me. But you have to make sure if you want to be at a super big academic program because research is something you're into, then that needs to be higher on your priority list. It's not as high on mine just because I don't, not as interested in it. So I think that you really have to take stock and inventory of yourself and then see how that matches with a school. And you'll get a feeling if it's the right school, if you could see yourself going there for sure.
Right. So I guess this one is more for Jan, but is it a myth that the DO curriculum is far more academically extensive than the ND? And I know that you touched on, of course, the OMT as being one of the main differences, but.
Yeah, maybe if I could just get a rephrase, academic extensive. I mean, besides the one extra class we take, I wouldn't really classify as extensive. We still graduate the same path, like, we have 2 years of didactics, 2 years of clinical rotations, and you apply synonymously as they merge the residency programs. You apply for residency. So, I mean, you'll have an extra 2 hours of lab a week. It's really not a big deal. So yeah, I guess yes, it is a myth. Besides OMT, that's the only really big difference of classes.
All right. Okay, so I think you just actually touched on this, but do DO and MD graduates both apply to the same residency positions for their respective specialties, or their designated residency positions for both?
I forgot who goes first. Abby, I think.
You got it, because I don't actually know a ton about it. So
Okay. So as of last year, so as of last year, MD-DO, same residency. You apply for the same residency service, and then okay, we'll backtrack. So before last year, I would say that DOs matched. Well, they had their own residency pool. MDs had their own residency pools, and when the DOs take step one, they can apply to MD residencies. And then this way, MDs couldn't apply to DO residencies. They have since gotten rid of that. Last year was the first year where it was completely merged, and we still have the same amount of, like, I think we had more ortho surgery residencies, gen surgery residencies matched. The only thing is that, so if, for example, Abby as an MD, if she was to hypothetically go to like a known DO residency route, she would have to have like some sort of OMM training. Because I know, like, I think like Chapel Hill is one of the first like MD schools to offer OMM if you want to learn it. But yeah, so like since from now moving forward, you all MD or DO go through the same residency app, and then you match for that respective specialty of your choice.
All right. Okay, so I think we're covering all of our questions like ahead of time, but I know that DOs can pursue most specialties, but most end up working in primary care. Do you think DOs who want to specialize are still prepared to do so as MD students?
Absolutely, because it doesn't matter what school you go to, it's how you perform on boards. If you're an MD student with average board scores, you're not matching neuro. It's as simple as that. If you're a DO student with high boards, you're more likely to match neuro. So whether you go to an MD school or DO school, it's how you perform, and making sure the school you go to is going to make sure you perform on test day to do that respective specialty. Like, yeah, we are mostly primary care, but you have to remember like what primary care entails. It's internal medicine, emergency medicine, OBGYN, and then of course family medicine, pediatrics, which I feel like most people go into anyways. I know we have like 55% go into primary care, and then so obviously the other 45% are going into some sort of surgical or anesthesia, or like I know anesthesia, gen surge, ortho surge, we've matched a pretty like sizable amount, where it's almost comparable to some of our local MD schools. And then I think we matched like one ophthalmology last year, and then that neurosurgeon. So I mean, it's doable. It all depends on the work you put in, that your board scores, and like how you shine on your rotations and the impressions you make.
absolutely, I agree. I don't really have much to add. Also, maybe just the only thing I will add is that even when you match your residency program, you're still learning. Literally you wake up one day and you have the MD or DO after your name. That doesn't mean you know everything about being a doctor. So most of your learning that you're going to be doing is on your residency program, in your residency routes. And so I think, again, like Jan said, it's what you make of it and that's kind of starting fresh at day one again of learning and continuing to apply all the things. So I don't think that I think it more depends on work ethic and how much you're willing to put into it.
All right. Okay, so is there a difference in job opportunities or availability if you pick a DO program over an MD program?
I mean, no, because you're matching the same residencies. So whether you're DO or MD, you're literally gonna have the same job. There are some like hospital like residency that are historically DO programs, but they have to have been accredited to match the MD-DO merger. So I mean, it just opens up the pool for that, like, so that me and Abby can apply to whatever it is we're interested in and not have to do 2 separate applications. We're going to apply for the same thing. And depending on where you interview, that's where you'll match, but that's a whole different, but I mean, opportunities available, no. The short answer, no. You're applying for the same job. You're to do residency and, again, pay off your loans till you die, so.
All right. Okay, so this one is interesting, I think. Do you think that the medical community views MDs and DOs differently? And I'll also add in there, do you think that the public views them differently? Because I want to hear your thoughts on that.
So I'll start on this one. I'll say older medical community might see it that way because somehow there is this perception that DO is not as good as MD, or if your MCAT scores aren't as high, like people, I know that that's the talk of pre-med people. I think that older physicians or older people in the medical community might think that, but especially in this day and age, me being out in the wards in the clinic, things like that, no one cares. Frankly, it's, again, just 2 different letters. You took 1 different class. And so I think at the end of the day, your expectations are no different between an MD versus a DO student, between an MD or a DO resident. You are asked the exact same things, and it's just whether or not you perform, not the letters after your name. So that's what I would say in the clinical world matters now, especially with people like now as older physicians are starting to retire and whatnot. As far as the general public, I don't think that anyone recognizes a difference. They just call you doctor. That's all it is. Honestly, the only people that know a difference or even look at it is people that know me, and when I was trying to pick between MD and DO and what the difference is. So I don't think that the public really views it that differently either. I think there are MDs that screw up, there are DOs that screw up. Some people are just bad doctors and slip through the cracks, and I don't think that that's on both sides. It's across the board. It has nothing to do with one program versus the other. So.
Yeah, if we had this conversation, I'll say 15 years ago, 20 years ago, absolutely. And this is why. And again, like just because I'm a DO student, I'm not going to defend DO to the day I'm just going to be as transparent and real as possible as I can be. So as up till about like 5 or 6 years ago, DO's MCAT scores, if you look them up, were pretty average, right? Your GPA was, again, a little average. I'll say like a 3.5. It's not really research incentive, whatever. And actually, back then, you could have, like, say, if you were to fail like Bio 1 and retook it, they won't count that failed bio into your GPA. It was called grade replacement. All those have long been gone as of like at least 3-4 cycles ago. Like our average MCAT is about a 507, where like 4 years ago it was like a 500. Our average GPA is around like a 3.6, 3.7, whereas 4 years ago you probably would have gone in with like a 3.4. And that's all like trying to make sure that we're leveling the playing field, right? So because now we're in the same residency program, so we have the same expectations coming out of both of us, whether you're an MD or DO. So again, like if you ask me this 15, that's why like when Abby alluded to like people who are older, right? People grew up with people who, like the way it went is like you either got to an MD school, then you went to the Caribbean, and then maybe you went to a DO school. Obviously today that's very different. Like please don't go to the Caribbean, right? So MD, DO, right? So how does the medical community view it today? Shouldn't be that different, and I think that stigma will even be erased even more. I'll say another 5-10 years down the line after seeing a couple rounds of residencies that have merged. I think they're even talking about one standardized board exam. I don't know how true or what's going on with that. So yeah, I mean, again, like the average GPA, average MCAT skyrocketed within the past like couple of years, and I will continue to do so. So that stigma of like, oh, if I don't get into an MD school, I'll just go to DO school. It's not gonna cut it. And trust me, interview times, they know if you're that person who's like, oh, I just wanted to be an MD, whatever, didn't get in, I'll just go to a DO school. You won't, like, they've done this for a long time. They know who's really done their research and wants to do a DO route, or who's okay with it, or compared to like, yeah, I wanted to go to Chapel Hill, didn't get in, so like Campbell, yeah, it's just not going to work out. Between that's the community with so like in the public, no one has any idea. My parents still, they don't even know the difference between MD and DO school. They're like, oh, my son's in med school. I'm like, you know what, just that's exactly what you start to, because then when you start saying he's osteopathic food, and they're like, oh, what, you know, it's just, I'm gonna be a doctor. That's all you have to worry about. That's it. No one, yeah. And yes, you can apply. There are 2 different application cycles. I forgot the one with the MD, but DO is the ACOMAS. And yes, apply at the same time. Please write 2 different letters of rec and just do some sort of research on OMM and the DL philosophy, because it will come up in interviews, and that is the quickest way you can get screened out or not accepted.
Yep, agree. Also, just again, I've already said it, but I'm going to repeat it one more time. Make sure you look at MD and DO programs and make sure they're not just cycling you through. Just really can't emphasize that enough, because I know too many people that have really been hurt by that and ended up in a lot of debt. So.
And to answer your question, why not Caribbean? I mean, no other way to say it. The Caribbean is just a scam. They're going to accept 800 students. Only 200 of you will graduate. So the other 600 of you just are in massive debt for no reason. They don't expect you to, I mean, again, like when they're saying they have a 97% match rate, yeah, it's because 600 of you failed out. So the 200 that should have been doctors, who are coming from like Canada or overseas, or even some here that slipped through the crack and deserve to be doctors, but didn't get into an American medical school and went on and did well in the Caribbean. Like, you know, that's rare, right? Like the way I explain it, the way it's said is that it's easy. Caribbean's easy to get in, hard to get out. Med school in America, whether it's MD or DO, is hard to get in, easy to come out. So take it for that. That is, I'd rather you take an extra year, or can we look? Callie, is that like American med school wise or for?
Yeah, like what Abby was mentioning about
Oh.
certain schools.
I'll let Abby answer that.
Yeah, I guess just really looking at like graduation rates, retention rates, just like Jan was saying, 800 people will get in, but if only 200 are graduating, that's a completely different story. I mean, even if you just talk around with people at that specific med school, like, hey, how many people typically repeat a year? Or how many people typically, you know, and there are people, I would say maybe 1 to 2 in my class per year have to repeat. Usually it's not because of academic stuff. Usually it's like they had to have a pause in school because a girl was giving birth, or like in the middle of the year, or some other thing like that. So I think that asking around is a good thing to do with like med students at current med schools. If it's published information, honestly, if it's not published information, that might tell you more too. Or if they don't want to tell you whenever you call and ask, because that's not a bad thing to ask. Again, just be very much on guard for that, because I think that they know how badly pre-med students want to get into med school, and that is normal to feel that way. But unfortunately, there are people that want to take advantage of that. I doubt retention rates are found on the MSAR. I don't remember that unless that's been updated in the past few years. Let's see. As far as out-of-state schools, some factors. If it is a public school, well, first off, any school, you should look at the percentage of out-of-state students. We have maybe 2 or 3 out-of-state students in my class of 72. And all of those out-of-state students are veterans, because we're pretty veteran heavy. So that just kind of shows you 98% of us, 99% of us are from in-state. If you're looking at out-of-state, private schools care a little bit less if it's in-state versus out-of-state. But again, those are going to be difficult to get into, not impossible. I have lots of friends that have gone to school out-of-state, and it's great. You just have to the biggest thing you need to do is be realistic, and that's through applying to med school and applying to residency. Don't try to apply to all these out-of-state colleges with a $4.99 and think that you're going to get into all of them, because that's not realistic. Even if they send you a secondary, I'm sorry, I think most schools send secondaries to every single person that applies because money, exactly. And that's just the reality. Like, those are things I wish someone had warned me of. Like, don't get, you kind of do have to be a tad cynical, and I'm not a cynical person. But There are people that apply out of state because they're good applicants at schools out of state or because they have specific reasons. Almost every school that's out of state that you apply to will have a question that asks, what are your ties to this state? If you have none, they are not probably going to look at you, honestly, unless you have like a crazy MCAT and a crazy GPA. And even that, they might not even look at you. You really, if you're going to apply out of state, need to have some type of tie, whether it's you grew up there, whether it's your grandparents that live there. You have to have something because it is always a question for out-of-state students. So be sure if you want to go out of state, that you're prepared for that.
So I mean, even though, so Campbell's a private school, so the in-state bias is not nearly as much as say Chapel Hill, because I think only about 55% of us, I mean, I'm from New York, so if 55% of us is from North Carolina that go to Campbell. But like, yeah, like I'd be saying, if you're going to an in-state school, like I'll say SUNY downstate or SUNY upstate in New York, and you're not from New York, yeah, you have to have a pretty good reason or like just insane, like much higher stats. Same way if someone from outside North Carolina wants to go to Chapel Hill Medical School, right? You can literally look this up. You have to have at least a 510 if you're out of state compared to just a 500. And again, like that's just like bare minimum. You need obviously a lot higher than that for Chapel Hill. But just to show you like the bias here, like, you know, the in-state versus out-state bias for those two. And I saw we had, and then just quickly, let's retouch about the Caribbean, just that like, I mean, feel free to message me about it. I just feel very passionate about like, if you're gonna go through all this time, like I want you to become a doctor and not like, I have at least 2 friends who are in thousands of dollars of debt that they got cut off from the Caribbean because you take a qualifying exam. If you do not qualify, you're done. Like at least here, like if you don't qualify, they're gonna put you in some sort of boot camp to make sure you pass boards. Again, because you can, that's a credit. Yeah, it's pretty bad. Yeah. So, and also even if you qualify and pass, and I'm just passionate about it because I've seen it. My own friends go through it. You get thrown around anywhere that a hospital will take you in the country for rotations. So my friend spent a month in Florida. The next month he's like, move, you're going to Arkansas. Like it's just anywhere that a hospital will take you for rotations compared to, I'm sure Abby can speak on her behalf, but for me, like you pick up 8 rotation sites, Raleigh being one of them, Fayetteville, depending on whatever you want, and you spend 2 years there rotating in that hospital. So a little, just, yeah. And then for the pass, someone asked about pass fail. Depends what the course is, but if you can't pass fail, like Chem 1, for example, unless you plan on retaking it, that's probably the biggest thing. Unless it's like philosophy or something, if it's just pass fail, they might ask on an interview why you pass failed it. But if it's a medical prereq exam, you have to have a class. You have to have a grade. It can't just be pass fail. And actual Caribbean is the same name as So like St. George's, Ross, like those 4, like in the actual like outside of America.
Someone asked about, this is a funny question, the first few years of med school being apparently very intense, and if there's any prior school experience that you could compare it to. My personal answer is absolutely not, because yeah, I've taken 18 plus hours in undergrad. It just doesn't compare. It's apples and oranges, med school versus undergrad, and that's my opinion. I think it is the analogy everyone loves to use. It's drinking water out of a fire hydrant. You have so much being thrown at you, and it is intimidating. And I'm not saying this to scare you, but it's the reality is that you have so much thrown at you that I don't even think you could put a credit hour on it. Let me look up what the credit, when we are answering questions later, I'm going to look up what the credit hour is. Something like 60, I don't know. What is it? Do you know, Jan?
I mean, because we're in cardiopulmonary block, cardio is like 4, pulmonary 2.5. They easily should be like 30.
Yeah.
But,
I mean, it's crazy. It's crazy the amount of, it's not comparable. And honestly, I always say this, there is nothing that anyone could have told me to prepare me for what the mental rigor like would be required of me. There's just not, you just have to go through it. And, you know, those that are younger than you are like, how the heck did you do this? And you're like, I don't know, I just got through it. And that's pretty much what everyone says and does. So enjoy undergrad. I know that sounds scary for med school, but enjoy it because you have way more free time. And also in med school, you do start to feel a bit guilty about like not studying. If you're ever not studying, you kind of always have that guilt. And I'm actually a very chill med student. Like, I'm not trying to be top 10%. I don't really care, because at the end of the day, I'm going to be a doctor. I'm not going to sell. You have to decide, like, are you going to sell your soul to med school? And some people, that's worth it to them. For me, it's not. So I'm very chill. I do have free time. I hang out with my friends. My class is only 72 people, so I hang out with them a lot. People do have families. I think it would be, it's doable for them. Some people treat it, oh gosh, hit something. Some people treat it like a 9-to-5 job. And so they only work all day, 9 to 5, or they get there 6 a.m. to 5 p.m. and then 5 p.m. after is just family time. Obviously that works differently with rotations, but it is manageable. But again, it's all about your priorities. You have to be honest with yourself about what kind of student you want to be, whether or not you want to sell your soul to medicine, and how important it is for you to be in the top 10% of your class. So.
Yeah, the only thing I would say is that, like, I honestly felt like the classes in undergrad were, okay, it's going to sound weird. Like, say, okay, like I'm in cardio and pulmonary. Everything I learn is related to cardio and pulmonary, and sometimes lectures overlap. So it's not like I'm like back in pre-med where I was taking like cell bio or orgo, where it's like random concepts of organic chemistry, and then I'm learning cell bio. You know what I mean? You're trying to balance like all these random like details and formulas and stuff. Where in like med school, it's like, yeah, it's a lot more, way more dense, but it's not like information I have to sit there like orgo. Like, I still to this day don't know what I learned in orgo. But like cardiopulmonary, at least like when I'm done studying, I'm like, okay, like I know I have to look at that again, but like I know what's going on. I just have to put in the details. It's also a lot, more fun to learn than random. You can clearly tell how passionate I am about orgo and gen chem and all that, or physics. I don't want to get me started on physics, but so yeah, it's definitely a lot, but it's more interesting stuff, and they all relate to each other. It's not like random, like, because you're all taking multiple like science classes. Yeah, I mean, me and my roommate started in the program together. We're on to started the master program. We all have our friends. You'll find people, whatever you're interested in. Like, I love playing basketball. We have a basketball group that we do intramurals with. Watch football on Sundays, for example. It's not like you're going to be constantly 24 hours studying, because again, like Abby, whether I'm first or last, I don't care. I'm moving on. I'm like, there are kids who study day and night and want to be top 10. That's good for them. To me, it's not what's important. As long as I'm learning information and I'm retaining it, and I can, do well on boards, that's what's super important for me. But yeah, everyone's super friendly. You'll find your click and do whatever it is that you might feel, you might have interest in, like sports or whatever.
Nothing quite brings people together and forms friendships like the mutual misery of medical school. So you will form your best friends in med school, because you all are questioning all of your life decisions up until that point. So you'll get close real fast.
Yeah, like I try to visit at least once a month, because my fiance lives in Charlotte, my family lives in Charlotte. That sometimes is tough to benefit, but like my partner is a pharmacist, so she understands like the volume of work and all that takes into it. So definitely, like, my advice for people in relationships and stuff, like, make sure your partner really knows what it is you're doing, because it can really take a toll, like, on your relationship, and especially being sort of long distance. Your family is everything. Trust me. Like, I call my mom at least once a week, be like, Mom, what am I doing here? And she'll, so whoever it is that brings you down to earth and all that stuff, like, don't lose those relationships, because trust me, they'll last more than like the stress that we go through now. So.
Absolutely. So I kind of touched on the percentiles earlier, and there have been more questions about that. I say just top 10% of your class. Like, again, for me, that's very skewed, because top 10% of my class would be 7 people. So, that's pretty small. But yes, somewhat people care about percentiles-ish, but only if you're like trying to be an orthopedic surgeon, or you're trying to be a neurosurgeon. Like, they're going to care more about those things. I'm personally interested in OBGYN or family medicine, with a little bit of some focus on OBGYN. again, lifestyle specialties are ones that are considered super competitive. Lifestyle specialties are the ones that require higher board scores. They are ones that care more about your percentile. For example, dermatology is a lifestyle specialty because, one, there's no emergencies. So, and if there are, they kind of wait till the next day. So you don't have any call really. You work but a plush 9 to 5, 9 to 4 office job, and then you cut off for the day. And that's not what a lot of doctor schedules look like. So that's, again, why it's one of the more competitive lifestyle specialties. Diagnostic radiology, I say, would be one of those. Cardiothoracic surgery, let's see, neurosurgery, all of those would be higher. Plastics, yes, all of those those ones that have, if it has a super high average board score average, then that is a lifestyle specialty probably. And again, it's just because you get paid a crap ton of money and you really don't have a call, and it's a little bit more chill, honestly. And that's why everyone wants to do it, and that's why everyone gets like super high scores, because obviously the demand is there for med students to get a lot of money for not working many hours, to be frank. Sports medicine, you can actually do sports medicine through family medicine. So that is awesome, and people definitely do that. Orthopedics, yes, very much. Honestly, this is probably bad, but we call them like the ortho boys, like, you know, the ortho boys, they're the guys that were the jocks on campus, probably in a fraternity, yada yada, which is a generalization. I shouldn't say that while I'm being recorded.
Yeah,
So sorry.
the thing is you should be able to bench your board score. So
there we go. If that just shows you the personality type. But yes, that is one of the ones that's super higher. Endocrinology, you can go, do you go through endocrinology through internal, I think, right?
Yeah. Internal fellowship, so it's an extra like 2 years of residence.
Yeah, so I wouldn't say that's lifestyle. Pediatrics, that's primary care, so that's not lifestyle. Those are going to ask for much more reasonable step scores and things like that.
But we have to,
yeah.
sorry, just real quick, because it's going to be different for them, because sports are going to be pass fail. So they're no longer going to use STEP to objectively, they're not, so it's going to be different for you guys, because I'm the last class that STEP will be scored, which gives me an advantage, because, well, I mean, not really, because I want to go into EM or IM, which is pretty not that competitive specialties. But if I wanted to be like any sort of like high-end surgeon or match into like a great IM spot at like Hopkins or whatever, usually that board score objectively tells me like, all right, that is within reach. But now if that's going to be pass fail, right, I don't know what they're going to, I think they're saying they're going to use step two. Yeah, and like use that. But everyone does well in step 2, or like you do better in step 2 than step 1, I should say. Your grades in med school have no bearing, because most of them are pass fail. And in class rank, the saying is if you're not first, you're last. So if you're not in the top like 10%, they're not going to include it on your dean's letter. So don't really work how to, don't really stress class rank unless you're like really like up there, and then that's like a pat on the shoulder for you. Ophthalmology is one of the hardest, definitely one of the most competitive. Again, because that's lifestyle. Like anything that pays the big bucks and you're not on call, it's very competitive, because that's the lifestyle people want. And then as far as
STEP, I can talk about STEP because I just took it, which is terrible. It is the most terrible thing. Someone, an M1 recently that just got in, asked me, is studying for STEP as hard as studying for the MCAT? And I was like, no, the studying for STEP is maybe 100 times harder. And I know that sounds like terrible and unimaginable to you at this point, but don't let that freak you out. You just make it through. You just kind of honestly fake it till you make it, and then you end up on the other side. So don't stress too much about that. But step 1, different schools have it. It's not a yearly test. Step 1 is typically, schools take it all at different times. So you have to look up, let me put in my email as well. You have to look up for different schools schools, like when they take step one, majority of the schools, however, that will take step one after your first 2 years in classroom. So your first 2 years are like going through regular college in classroom, learning a bunch of crap, and then you take step one at the end of that 2 years. And then now I took step one, so now I'm on my third year clinical rotations. At the end of my third year, after I've gone through all 8 of my clinical rotations, I will take step two. Now, step one, the one that I just took before third year, it after next year, after Jan's year, will only be pass fail. Before this, part of the reasoning is because before this, there was a huge, if you think your MCAT's important, it's like nothing compared to how important the USMLE step one is to your residency. People didn't like that. There were lots of issues and controversy about how much emphasis is placed on one single test, which honestly I agree with personally. But again, it's just like taking away the ACT for college. If you don't have the ACT, how are you going to standardize and look at all these different schools whenever you're looking for residency? So step two is the one you take at the end of your third year. And then for third year, you take step two. And again, like Jan said, people do typically score higher and better on step two. It seems like that's where the emphasis is going to come from. Difference between step one versus step two. Step one is how much random, small, one word in a book that you've never heard of, one sentence, how well can you remember that? One fact out of the bajillion of pages that you've ever read in med school. Honestly, it's just a lot of memorization. It's a lot of detail. Step two is more clinically oriented. It's how are you going to treat this patient? Are you going to get him a CT scan? Are you going to get him an MRI? Like, what are you going to do? So if you fail, you have to retake. Failing is a big red flag, honestly. So you just retake it, and it is a red flag, but there are tons of people that match even if they fail. Yeah, most people, I think we maybe have one person that failed each year, and that's out of 72, which is even a higher percentage than Jan's. But again, that's again why it's important for you to have a school that cares about you as a student, because it reflects poorly on you as well as reflecting poorly on the school. So for us, our school looks at our scores, and if they're like, hey, you're not doing so hot, let's go back to the drawing board, figure it out. We're not going to let you take this till you're going to pass. And that's the kind of school that you want to be in. And then there's something called step three. Yeah.
Sorry,
go ahead.
and that right there is the biggest difference between American and Caribbean medical school. Because if you don't pass that qualifier, you're gone. For us, God forbid I never have to experience it, but there's a 4-week boot camp where it's like they'll literally send you to Kaplan and be like, you learn all this stuff in 4 weeks, and then you will not be able to sit for boards until you have a certain score on a qualifying exam. And for us, we take 3 through the year. I don't know how many you guys take, Abby. Until you pass those all 3, you cannot take the boards because they're not going to set you up for failure. I had a friend of mine, a friend of mine who just took it last year. He's a 4th year now. He had to take 2 vacation months in order to sit. So like you're usually allowed I think 1 vacation month a year.
Yeah.
Or when you're on rotation. He used both of his. So now he is on straight up rotation from now until he graduates in order to make sure that he does not fail boards, and he did pretty well. And this is a person who had to remediate classes, which is also a big red flag, and you don't want to do. You want to make sure you pass all your classes. And so for someone like that to still not only pass but have a pretty good board score, that would get him into semi-competitive residencies. Should be reassuring that the school that you go to, they have to have your back, because at the end of the day they care about them still being accredited and still having a program.
Absolutely. I think they said we're gonna start wrapping up. I'll just answer that last question and kind of just say my last piece on it. But our classes are pretty much pass fail. There's some graded components, but we just went to pass fail. We were one of the few schools that was left that was still doing grades, and then we were finally like, no, just do pass fails. Yeah, it stinks to still be doing grades. So my transcript's going to look real wacko because my first year I had grades. My second year, we just went completely pass fail, which is awesome, especially second year when you're studying for STEP. But I want to emphasize you all are in undergrad right now, and you should not be worrying about STEP whatsoever. This is just, we are talking about this because you should have an idea. I don't think I knew what step 1 was when I applied to med school because I was just trying to get in, and that's okay to be there. You don't have to be 10 steps ahead and all of that. You'll get there when you get there. You'll cross the bridge when you cross the bridge. The biggest thing I would say is, especially coming from today's talk, is as an MD student, no one gives a crap if you're an MD or a DO, as long as you're a doctor at the end of the day, and as long as you know that this is what you want to do, and so much so that that's going to get you through the 4 years. So yeah, that's my takeaway for you all is like, do it because it's the only thing that you could see yourself doing. And as far as MD, DO, it's bureaucratic BS that no one really cares about. So.
All right, so thank you so much for coming out today, Abby and Jan. I appreciate both of y'all coming to join us. So I guess we move through the Q&A, we move straight into it. So I'm going to share one opportunity before we move into wrap up. Let's see.
Hey, Ryan, real quick,
Yeah.
sorry, just to touch upon, because like Abby, like it hit on the money, like you guys, like right now, like don't worry about like you thinking like you're gonna go into some sort of specialty, because by the way, most people who go into first year thinking they know what to want to do end up changing it. Find what really makes sense to you. Please don't do stuff just because you think it's gonna look good on your application. I don't like research. I tried it, but I don't like it. So once I did research and I had like so many advisors telling me like they'll like try to like be like, okay, what'd you learn, this and that, and I couldn't answer, and they're like, right there, your interview would have been gone. Like they would have been like, yeah, this kid just did a bunch of stuff thinking it looked good, trying to impress us, but he doesn't even know what he was doing. So if research is important to you and you like it and you can talk and defend your research, by all means go for it. But if you're in someone who doesn't, and I'm just using an example of research, like find what's important to you, like, you know, like Project Sunshine, all that stuff, like, you know, do what you want to do because it means something to you and it'll be more rewarding in the end. Try to do the best you can with your classwork, and, you know, just, you know, take it day by day. It's a long journey, but if we can do it, you guys can too. And I truly mean that.
All right, thank you very much. So I wanted to share this. So after today's conversation, Dr. Eastland did send out this opportunity back on August 25th. There's a virtual, it's essentially a pre-med fair for the Southern DO colleges of medicine. I'm trying to think, there's 15 colleges that are going to be in attendance, and it's actually tomorrow. All you just have to do is register, and Campbell is on there. So if you're interested in learning more about DO schools, feel free to go to that event. Now I'm going to switch back to the wrap up so Muhammad can end us up.
All right. Well, like Ryan already said, Abby, Jan, thank you so much for coming. Y'all definitely like enlightened us on a lot of stuff when it comes to DO and MD schools. Again, for the rest of you guys, don't forget to follow us on Instagram at NC State Pre-Med. That's where we send out like our quickest updates, and like I'm sure most of us like check our Instagram before we check our email, so it would be good to follow us. Our next meeting will be September 16th at 3. Again, that's Wednesday at 3 p.m. in 2 weeks. We'll send out the details once we've planned that out for sure. Again, you can reach out to me at MSCon3 or Ryan or Ryan at RJ Taylor. Send us any questions, any feedback you guys have, and we will send out a recap email that includes the YouTube link for this meeting, and also the PowerPoint. So thank you everybody for coming. Stay safe, and we'll see you guys later.
Bye, y'all.
Bye.
Thanks for having us.
Thanks for coming.
Thank you.